Now to health matters, Vice President Kashim Shettima has urged Nigerian resident doctors to remain in the country and support President Bola Tinubu's administration to improve healthcare delivery. He said if doctors resisted the temptation of seeking greener pastures abroad, they would realize that President Tinubu had their interest at heart. Shettima said this when he hosted the National Executive Committee of the Nigerian Medical Association, led by its new president, Professor Bala Audu, at the State House in Abuja. The vice president lauded the sacrifices of Nigerian doctors and encouraged them to stay back and salvage the nation together. To discuss this, I'm joined by President Resident Doctors, Ekiti State University Teaching Hospital, Dr. Adeyemi Famous. Hello, Doctor. Thank you for joining us at this time.
Thank you very much. Good afternoon.
Good afternoon.
Thank you for having me.
Yes, indeed. All right. So, Doctor, do you believe Vice President Shettima's statements that doctors are to remain in the country, or doctors remain in the country is a viable solution to the challenges faced by healthcare professionals in Nigeria?
Yeah, thank you very much. We must say and commend the Vice President Shettima for meaning well for the people of Nigeria by advising the doctors to stay in the country without looking for greener pastures elsewhere. But we must say that the necessary things are to be put in place, are to be done if the doctors are to stay put.
All right, so we've been able to reconnect with Dr. Famous. We were speaking to him earlier on the Vice President, Kashim Shettima, saying doctors should not leave Nigeria for greener pastures and they would reap the dividends of what the administration has in store for them. Hello, Doctor. Thank you so much for reconnecting with us.
Thank you very much. Very sorry for the network issues.
No, it's not your fault.
I was saying that we have to sincerely appreciate the Vice President for trying to implore the doctors not to buy into the Japa Syndrome that is currently ongoing in Nigeria. I'm trying to say that this Japa Syndrome has been on for a while now, and it calls for the attention of the government, the stakeholders, private sectors, everyone, all hands must be on deck for this issue or these menace to be addressed. Because as we currently speak, the health indices that we use to calculate the availability of sound health or good health care or services and in any country is dropping and dwindling in Nigeria. Talk of maternal mortality rate, talk of under 5 mortality rate, infant mortality rate. Nigeria is, the maternity rate for Nigeria is one of the worst even in sub-Saharan Africa, third to that of South Sudan, Chad. So it's extremely high, even the under 5 mortality. And it's not, no doctor wants to, given every opportunity or every chance, the doctors will not want to even go out of the country. We love to be at home, offer our services and our care. But in this Japa syndrome, there are factors. We have the push and the pull factors that are responsible for the Japa syndrome. Now, if we have to address them, you will understand and agree with me that the government of the country has a lot of things to do, and they must show responsibility and commitment to addressing this issue on time. And the Nigerian masses must be able to bring them to correcting this issue before it gets to the barest worst. Now, what are we saying? Are we talking of the poor remuneration that the doctors are getting in Nigeria? I want to tell you that it's one of the worst all over the world. Are we talking of the poor working condition? There are no facilities to work. Every doctor wants a good facility, equipment to work. But, what we have
so all
in
of
Nigeria
these challenges that you've actually listed out and more, do you see this administration, working towards making it better already? It's been 1 year since they've been in power.
Okay, we have to appreciate the government of the President Bola Ahmed Tinubu. No, first of the positive effort that we are seeing from his side is a slight increment in the percentage budget slightly increased above what it used to be in 2021, 2022, 2023. That of 2023 was about 4.6%. And I think this year's own was about 4.8%, which has a slight increase. So it's a positive sign, to this. But how does it translate to good health services for the Nigerians? According to Abuja Declaration of 2001, the budgetary allocation to the health sector should be up to 15%. How is Nigeria living up to that? If at all they cannot get up to 15%, they should be way above 5% that it used to be. In 2015, if I'm correct, it was about 5.8%. It was higher than what we are having currently, and it was able to address some of these challenges to a particular level. Now, I want to tell you that there is a trend in Nigeria now.
All right, well, thank you so much, Doctor. Thank you. Thank you so much, Doctor. Sadly, time is not on our side, but thank you so much for speaking to us on this.